Welcome to Practice Test 13 in our Complete NCLEX review series. In this session, we are going to challenge your knowledge with carefully selected, high-yield NCLEX-style questions designed to sharpen your critical thinking, boost your test-taking strategies, and build your confidence for exam day. Each question will come with detailed explanations and clinical pearls to help you understand the why behind the correct answers, not just memorize facts. Whether you are here for a final review or to strengthen specific topics, you are in the right place. Make sure you have your notes ready, stay focused, and let us work through these questions together so you can feel fully prepared to succeed on the NCLEX. And remember, if you are serious about passing the NCLEX on your first attempt, check out our Complete NCLEX review course linked below for live classes, hundreds of hours of lectures, NGN question breakdowns, mock CAT exams, and more. Let us dive right in. Your question is coming up. Question 1. Let us begin with an important scenario involving emergency triage during a mass casualty situation. The nurse is assessing multiple clients who were involved in a serious bus collision and must decide which client requires immediate transport to the trauma facility. Here are the options to consider. Option A, a client with marked swelling and pain in the right forearm who retains both distal pulse and sensation. Option B, a client who is not breathing and has heavy bleeding from a chest wound. Option C, a client whose leg has been crushed with an absent distal pulse and no feeling below the injury. Option D, a client who appears highly anxious and has multiple abrasions on the arms. The correct answer is option C, a client whose leg has been crushed with an absent distal pulse and no feeling below the injury. Now, let me explain why this is the correct choice. The client described in option C is experiencing critical damage to the limb with loss of circulation and sensation, which indicates a severe vascular compromise that threatens both life and limb. In mass casualty situations, this client would receive a red tag classification, signaling the need for immediate life-saving intervention and rapid transport to the trauma facility. In contrast, the other options reflect injuries that, while significant, do not demand the same level of immediate priority. Question 2. Moving on, let us look at a question involving client education for diagnostic imaging. The nurse is providing instructions to a client who is scheduled for an intravenous urography, also called an intravenous pyelogram. The key here is to determine which client statement demonstrates a proper understanding of the preparation required for this procedure. Here are the options. Option A, I will need to have a urinary catheter placed during the test. Option B, I should take a laxative the evening before so my bowels are cleared. Option C, I should drink water to fill my bladder just before the imaging starts. Option D, it is normal to see blood in my urine for a few days following the test. The correct answer is option B, I should take a laxative the evening before so my bowels are cleared. Here is why this is the best response. Taking a laxative the evening before the test is an essential part of preparation, as it helps ensure that the bowels are emptied. This prevents gas or stool from obscuring the view of the urinary tract structures during the imaging process. During the procedure, contrast dye is administered intravenously, and a series of X-rays are taken to trace urine flow from the kidneys to the bladder. The other options do not correctly reflect standard preparation steps for this diagnostic test. Question 3. Let us continue with a question focused on prioritizing care for a client diagnosed with Guillain-Barré syndrome. The nurse must determine which action should take top priority in this client's plan of care. Here are the options to consider. Option A, frequently evaluating the client's respiratory function. Option B, administering the prescribed intravenous immunoglobulin therapy. Option C, performing passive range of motion exercises to prevent joint stiffness. Option D, observing for signs of autonomic dysreflexia. The correct answer is option A, frequently evaluating the client's respiratory function. Here is the rationale behind this choice. Guillain-Barré syndrome is characterized by progressive ascending paralysis that can ultimately affect the respiratory muscles. Therefore, the priority is to closely monitor respiratory status so that any signs of respiratory compromise can be identified early, allowing for prompt intervention before respiratory failure occurs. Question 4. Now let us shift our attention to an emergency scenario involving potential bioterrorism. A client has arrived at the emergency department after being exposed to inhalation anthrax, and the nurse must anticipate which medication the healthcare provider will prescribe for initial treatment. Here are the choices. Option A, acyclovir. Option B, zidovudine. Option C, ciprofloxacin. Option D, oseltamivir. The correct answer is option C, ciprofloxacin. Let me explain the reasoning behind this selection. Ciprofloxacin is the primary antibiotic recommended for both post-exposure prophylaxis and initial treatment of inhalation anthrax, a life-threatening infection caused by the gram-positive bacterium Bacillus anthracis. Typically, treatment begins with intravenous administration of bactericidal antibiotics, often in combination with other agents, followed by an extended course of oral antibiotics to prevent relapse. Before we continue with the next high-yield NCLEX question, I have something exciting to share that could make your exam prep easier and more effective. If you are finding this video helpful, just imagine having access to live classes, a 100-hour animated crash course, over 500 hours of detailed recorded lectures, 500 next-generation NCLEX-style questions discussed step-by-step, 5,000 previously asked NCLEX questions, and 15 full-length mock CAT tests, all in one place. Our complete NCLEX review course also includes an exclusive NCLEX ebook, a personalized study planner for 1 week, 1 month, or 3 months, PDF notes, and 1 full year of access after you enroll. Question 5. Let us now move to a critical care scenario involving cardiac monitoring. While observing a client on continuous cardiac monitoring, the nurse notices that the monitor alarm sounds and no QRS complexes appear on the screen. The question is, what should be the nurse's very first action in this situation? Here are the options to consider. Option A, activate the record function on the electrocardiogram. Option B, verify proper placement of the monitoring leads on the client. Option C, call for the code team immediately. Option D, notify the healthcare provider about the rhythm. The correct answer is option B, verify proper placement of the monitoring leads on the client. Let me walk you through the reasoning. The nurse must first confirm that the monitor leads are securely attached and correctly positioned, because dislodged or loose leads can result in false readings that might mimic serious arrhythmias, including a systole. This critical first step helps ensure that the nurse is responding to an actual life-threatening rhythm rather than a technical error. Option A is not the best response because simply recording the rhythm does not address whether the monitor is providing accurate data. Option C, calling the code team, would be premature without verifying the lead placement or assessing the client. Similarly, option D, notifying the healthcare provider, should come only after confirming that the rhythm disturbance is genuine. The key takeaway is that before triggering emergency interventions, always verify both the client's actual status and the monitoring equipment to avoid unnecessary or inappropriate actions. Question 6. Next, let us explore a mental health scenario involving medication management. The nurse is caring for a client who has been diagnosed with bulimia nervosa and must consider which medication the healthcare provider is most likely to prescribe as part of the client's treatment plan. The options are as follows. Option A, metformin. Option B, bupropion. Option C, fluoxetine. Option D, clozapine. The correct answer is option C, fluoxetine. Here's the rationale. Fluoxetine, which is a selective serotonin reuptake inhibitor, is the only medication that is specifically approved for treating bulimia nervosa. It helps reduce binge purge episodes and can also address coexisting conditions such as generalized anxiety disorder. Importantly, it is most effective when combined with psychotherapy. Option A, metformin, is used primarily to manage blood glucose levels in diabetes and is not appropriate for bulimia, as it may lead to undesired weight loss. Option B, bupropion, is contraindicated in bulimia nervosa because it increases the risk of seizures and may also promote weight loss. Option D, clozapine, is an atypical antipsychotic that has no role in treating bulimia nervosa. The key point to remember is that fluoxetine is the first-line pharmacologic treatment for bulimia nervosa, and it works best alongside therapy, although it can have side effects such as insomnia, agitation, sexual dysfunction, and potential weight changes. Question 7. Let us now consider a question involving prevention of healthcare-associated infections. A client is receiving mechanical ventilation through an endotracheal tube, and the nurse must determine which action would not help reduce the client's risk of developing ventilator-associated pneumonia, or VAP. The options are as follows. Option A, providing oral hygiene at least every 2 hours. Option B, collecting a tracheal suction specimen for culture. Option C, keeping the head of the bed elevated between 30 and 45 degrees. Option D, performing hand hygiene before and after suctioning. The correct answer is Option B, collecting a tracheal suction specimen for culture. Let me explain why this is the correct choice. Although obtaining a suction specimen is important when infection is suspected, so that appropriate treatment can be started, it does not play a role in preventing pneumonia. On the other hand, strategies such as frequent oral care, maintaining the head of the bed at an elevated angle, and performing proper hand hygiene are all key interventions that lower the risk of introducing pathogens and reduce the chance of aspiration. The essential point here is that VAP prevention focuses on minimizing opportunities for infection, not just detecting it once it occurs. Question 8. Now let us move on to a scenario involving fluid balance and monitoring effectiveness of therapy. The nurse is caring for a client who is receiving intravenous fluids to treat fluid volume deficit. The question is, which finding would suggest that the client's therapy is achieving the desired outcome? Consider these options. Option A, urine output of 20 milliliters per hour. Option B, blood urea nitrogen, or BUN, level of 15 milligrams per deciliter. Option C, urine-specific gravity of 1.039. Option D, flattened jugular veins. The correct answer is Option B, blood urea nitrogen level of 15 milligrams per deciliter. Here is why this is the best answer. A BUN level of 15 milligrams per deciliter is within the normal range of 10 to 20 milligrams per deciliter, indicating that the client's hydration status has improved. In fluid volume deficit, BUN levels are often elevated due to hemoconcentration, so normalization is a good sign that fluid therapy is working. In comparison, a urine output of 20 milliliters per hour remains too low to indicate adequate perfusion. A urine-specific gravity of 1.039 reflects concentrated urine and ongoing dehydration, and flattened jugular veins suggest continued hypovolemia. The key point here is that normalization of laboratory values like BUN helps confirm effective rehydration. Question 9. Shifting to a mental health scenario, let us look at the care of a client newly admitted to a mental health unit with anorexia nervosa. The nurse needs to select the most appropriate initial nursing intervention for this client's plan of care. The options to consider are the following. Option A, allow the client to select items from the menu independently. Option B, request an order for psychotherapy sessions. Option C, encourage the client to determine their own meal schedule. Option D, obtain a prescription for fluoxetine. The correct answer is Option B, request an order for psychotherapy sessions. Here is why. Psychotherapy, especially cognitive behavioral therapy, is the cornerstone of treatment for anorexia nervosa because it helps address the distorted thoughts and beliefs about food, weight, and self-image that contribute to the disorder. Option A is not appropriate early in treatment because clients typically require guidance in making nutritional choices. Option C is not correct because structured meal times provide consistency and reduce anxiety about eating. Option D is incorrect as fluoxetine is not an approved treatment for anorexia nervosa, even though medications may sometimes be used off-label. The key takeaway is that structured therapy is the first-line intervention to help clients begin recovery from anorexia nervosa. Question 10. Finally, for this segment, let us focus on postoperative care in a pediatric client. The nurse is caring for a child who has just arrived in the post-anesthesia care unit, or PACU, after undergoing a nephrectomy. The nurse must decide which assessment should take priority immediately. The options are as follows. Option A, evaluate the child's pain level. Option B, inspect the peripheral vascular access device. Option C, check the surgical site. Option D, measure and assess vital signs. The correct answer is Option D, measure and assess vital signs. Here is the reasoning. In the immediate post-operative period, the first priority is to assess the child's vital signs to determine overall stability after anesthesia and surgery. Monitoring respiratory status, oxygen saturation, heart rate, blood pressure, and temperature allows the nurse to detect complications such as respiratory depression, shock, or hypothermia at the earliest possible moment. Although pain management, assessing the IV site, and inspecting the incision are all important components of care, they are not as urgent as confirming the child's hemodynamic stability. The key point here is that vital signs provide essential information about life-sustaining functions and must always come first in the PACU. Let me pause here for just a moment to remind you, passing the NCLEX is not about luck. It is about preparation. And that is exactly why we created the complete NCLEX review course just for you. Inside, you will find live classes, over 500 hours of recorded lectures, 100 hours of animated crash course content, 500 detailed next-generation NCLEX-style questions, 5,000 previous exam questions, 15 full mock CAT tests, an exclusive NCLEX ebook, and personalized study planners for your unique timeline. Plus, you get 1 year of access so you can study at your own pace. Ready to take control of your success? Check out the link in the description and let us help you cross the finish line. Question 11. Let us move forward to a question involving discharge teaching for a client with a new colostomy. The nurse is evaluating the client's understanding of colostomy care and must identify which statement suggests the need for further education. Here are the options. Option A. If my stoma turns bluish in color, I will contact my healthcare provider right away. Option B. I plan to slowly add high-fiber foods back into my meals. Option C. I will always wear a pouch over the stoma to collect output. Option D. I will clean the skin around the stoma with rubbing alcohol to keep it dry. The correct answer is Option D. I will clean the skin around the stoma with rubbing alcohol to keep it dry. Let me explain why. Rubbing alcohol is far too harsh for the delicate skin surrounding the stoma and can lead to irritation, skin breakdown, and problems with appliance adhesion. Instead, clients should use mild, non-moisturizing soap and water to clean the area. The other statements reflect accurate understanding, such as promptly reporting a bluish stoma, gradually reintroducing fiber, and wearing a pouch consistently to manage output. The key point is that gentle, appropriate skincare is essential to prevent complications and ensure the appliance stays securely in place. Question 12. Now, let us examine a scenario where the nurse must determine which client needs the most immediate follow-up. The nurse is caring for several clients, and here are the options. Option A, a client 2 days post-myocardial infarction with persistently elevated troponin levels. Option B, a client with infective endocarditis expressing a desire to leave against medical advice. Option C, a client with arterial insufficiency reporting leg pain after walking in the hallway. Option D, a client recovering from cardiac catheterization who has newly developed atrial fibrillation. The correct answer is Option D, a client recovering from cardiac catheterization who has newly developed atrial fibrillation. The reason is that the sudden onset of atrial fibrillation in this setting poses a significant risk of thromboembolism and stroke, demanding prompt intervention. While elevated troponin levels may persist after a heart attack, and claudication is a chronic symptom of arterial disease, neither is as urgent as this new arrhythmia. Although the client wanting to leave against medical advice is a serious situation, it does not carry the immediate risk of embolic complications seen with new onset atrial fibrillation. The key takeaway is that new arrhythmias after cardiac procedures require immediate attention to protect the client from life-threatening complications. Question 13. Next, let us look at a pharmacology question concerning acne treatment. A client is about to begin isotretinoin therapy for severe acne, and the nurse must identify which baseline laboratory test is most important before starting this medication. The options are as follows. Option A, lipid panel. Option B, C-reactive protein. Option C, hemoglobin. A1C. Option D, international normalized ratio, or INR. The correct answer is Option A, lipid panel. Here is why this is the best response. Isotretinoin can cause significant increases in triglycerides and other lipid levels, so checking a baseline lipid panel is essential. This allows the healthcare provider to monitor for any dangerous changes during therapy. The other options are incorrect because C-reactive protein assesses inflammation unrelated to isotretinoin, hemoglobin. A&C monitors long-term blood glucose control, and INR measures coagulation status, none of which are relevant to this medication. The key point is that along with lipid levels, liver function and pregnancy testing are also vital to ensure the client's safety while on isotretinoin due to its risk of hepatotoxicity and teratogenicity. Question 14. Finally, in this segment, let us review a question about preparing for a diagnostic procedure. The nurse is teaching a client who is scheduled for a colonoscopy and must provide accurate information about preparation. Here are the options. Option A, you can eat a normal diet the day before the procedure. Option B, you should not eat or drink anything for 4 to 6 hours before the test. Option C, it is common to have chalky white stools after the colonoscopy. Option D, you should expect significant abdominal pain and bloating afterward. The correct answer is Option B. You should not eat or drink anything for 4 to 6 hours before the test. Let me explain why. Fasting ensures the colon remains clear for optimal visualization during the procedure. Option A is incorrect because clients typically follow a clear liquid diet and complete bowel preparation the day before. Option C is inaccurate because chalky stools occur after barium studies, not colonoscopy. Option D is also incorrect, as significant pain or bloating could signal a complication such as perforation. The key takeaway is that proper bowel cleansing and fasting are essential for a safe and effective colonoscopy. See the question. 15. The nurse is assessing a client with schizophrenia who is engaged in a conversation. The client begins discussing their plans for dinner, then shifts to talking about their favorite childhood toys, and eventually starts describing the weather, without ever answering the nurse's original question. The nurse recognizes this speech pattern as which of the following? See the options. A. Flight of ideas. B. Tangentiality. C. Perseveration. D. Clang associations. The correct answer is B. Tangentiality. C. The explanation. Tangentiality is a communication disturbance in which the client starts to answer a question, but veers off onto unrelated topics and never returns to the original point. It is commonly observed in schizophrenia and other thought disorders. The person's speech may appear logical at the level of individual sentences, but fails to stay on topic. Question 16. Let us now focus on prioritization in respiratory assessment. The nurse is assessing a client who has been admitted with pneumonia and must determine which assessment should take priority. The options are as follows. Option A, checking the client's temperature. Option B, monitoring the client's oral fluid intake. Option C, listening to the client's lung sounds. Option D, reviewing the client's white blood cell count. The correct answer is Option C, listening to the client's lung sounds. Here is the reasoning behind this choice. In pneumonia, lung sounds provide critical, real-time information about airway patency, gas exchange, and whether the client may require interventions such as suctioning, bronchodilators, or supplemental oxygen. While monitoring temperature, fluid intake, and white blood cell count are all important parts of care, they do not give immediate insight into the client's risk for hypoxia or respiratory failure. The key point is that in pneumonia, respiratory assessment is always the priority to safeguard oxygenation and prevent complications. Question 17. Moving on, let us consider an emergency cardiovascular scenario. A client arrives at the emergency department with a heart rate of 42 beats per minute, blood pressure of 90/60 millimeters of mercury, and complaints of dizziness. The nurse must decide what action to take first. The options are: Option A, request a chest X-ray order. Option B, review the client's medication list. Option C, conduct a focused neurological assessment. Option D, obtain a 12-lead electrocardiogram. The correct answer is Option D, obtain a 12-lead electrocardiogram. The rationale is that these vital signs point to symptomatic bradycardia, and an electrocardiogram is essential to assess the cardiac rhythm and guide immediate interventions such as intravenous atropine or pacing. A chest X-ray and medication review can follow, but do not address the immediate need to confirm and manage the arrhythmia. Similarly, while a neurological assessment is valuable, the client's dizziness is likely due to reduced cardiac output, making rhythm evaluation the priority. The key takeaway is that rhythm assessment comes first in symptomatic bradycardia, so that life-saving measures can be initiated without delay. Question 18. Next, let us turn to a patient safety scenario on the surgical unit. The nurse manager discovers that several clients were nearly sent to the operating room for incorrect procedures, but fortunately, these errors were caught before harm occurred. The question is, what should be the first priority action? The options are: Option A, recognize the staff for identifying and stopping the near misses. Option B, investigate and analyze the circumstances surrounding the near misses. Option C, classify these incidents as medical errors and begin reporting them. Option D, report these occurrences to the State Department of Health. The correct answer is Option B, investigate and analyze the circumstances surrounding the near misses. The reason is that near misses highlight system vulnerabilities. and prompt investigation helps uncover root causes and implement safety measures to prevent future errors. While staff recognition, reporting actual medical errors, or external reporting may be appropriate later, the immediate priority is to understand how the near misses occurred. The key point is that analyzing near misses offers a valuable opportunity to strengthen safety systems before harm occurs. Question 19. Let us now look at a question related to cardiac rhythm interpretation. The nurse is reviewing a client's electrocardiogram tracing, which shows atrial fibrillation. Based on this finding, the nurse should expect to observe which clinical manifestation. The options are: Option A, jugular venous distension. Option B, systolic murmur. Option C, irregular heart rhythm on palpation. Option D, widened pulse pressure. The correct answer is option C, irregular heart rhythm on palpation. Here is why. Atrial fibrillation is characterized by an irregular pulse, meaning the heartbeat is erratic without a predictable pattern, and this is often noticed first when palpating the pulse. Jugular venous distension is more typical of right heart failure. Systolic murmurs are linked to structural valve disease, and widened pulse pressure occurs in other conditions such as late increased intracranial pressure. The key point is that atrial fibrillation presents as an irregular rhythm and increases the client's risk for thromboembolic events like stroke. Question 20. Finally, for this section, let us consider a sensitive scenario involving a new diagnosis. During shift report, the nurse assumes care of an infant who has just been diagnosed with cystic fibrosis. The question is, what should be the immediate priority in caring for this client and their family? The options are: Option A, coordinate a referral to a pediatric pulmonologist. Option B, offer emotional support to the family members. Option C, begin the process for obtaining financial assistance. Option D, arrange for parental genetic testing as they plan for future children. The correct answer is Option B, offer emotional support to the family members. Here's the reasoning. When a family has just learned that their child has a life-limiting chronic condition like cystic fibrosis, they are experiencing emotional distress and uncertainty. The most urgent nursing role is to provide compassionate support, answer questions, and help the family begin to process the diagnosis. While referrals, financial assistance, and genetic testing are important steps, they can follow after the family's immediate emotional needs are addressed. The key point is that emotional support is vital at the moment of diagnosis to help families begin coping with the life changes ahead. Question 21. Let us now turn to a situation involving acute anxiety management. A client with a known anxiety disorder arrives at a busy mental health clinic and, overwhelmed by the environment, begins to experience an acute anxiety attack. The nurse must determine the most appropriate first action. Here are the options. Option A, provide 1 tablet of alprazolam immediately. Option B, encourage the client to talk about their feelings. Option C, escort the client to a quiet, private area to rest. Option D, obtain the client's vital signs. The correct answer is Option C, escort the client to a quiet, private area to rest. Here is why. Removing the client from the overstimulating environment and placing them in a calm, low-stimulation setting is the most effective immediate intervention to help reduce anxiety and support de-escalation. Giving medication without an order, as in Option A, is inappropriate and does not address the environmental trigger. Encouraging verbalization, as in Option B, may not be helpful during the peak of an anxiety attack because the client may not be able to process or express their feelings. Taking vital signs, as in Option D, is secondary to calming the client and would not change the immediate intervention. The key takeaway is that creating a safe, quiet environment is the top priority to help the client recover from an acute anxiety episode. Question 22. Now let us move to a scenario involving a medication error. The nurse is caring for a client with diabetic ketoacidosis who was prescribed a 0.1 unit per kilogram regular insulin bolus followed by a continuous infusion. However, the nurse mistakenly administers 1 unit per kilogram as the bolus. The question is, what should be the nurse's priority action? The options are: Option A, notify the healthcare provider. Option B, complete an incident report. Option C, assess the client for signs of hypoglycemia. Option D, stop the regular insulin infusion. The correct answer is Option C, assess the client for signs of hypoglycemia. Let me explain the reasoning. Regular insulin administered intravenously works quickly, peaking within 15 to 30 minutes. Therefore, the immediate priority is to evaluate the client for hypoglycemia by checking blood glucose levels and watching for symptoms such as confusion, sweating, or rapid heartbeat. Contacting the healthcare provider, documenting the error, or altering the infusion are important steps, but they should come after ensuring the client's safety through prompt assessment. The key point is that when a medication error occurs, the nurse's first responsibility is to assess the client for harm and take immediate action as needed. Question 23. Let us shift to a teaching scenario involving endocrine disorders. The nurse is preparing educational material for staff about conditions that can lead to elevated cortisol levels. Which condition should the nurse emphasize in this teaching? The options are Option A, Addison's disease. Option B, congestive heart failure. Option C, renal failure. Option D, Cushing's disease. The correct answer is Option D, Cushing's disease. Here is why. Cushing's disease is caused by excess production of cortisol, often due to a pituitary adenoma that overstimulates the adrenal glands. This hormonal excess affects metabolism, raises blood glucose levels, increases blood pressure, and suppresses the immune response. The other options do not cause elevated cortisol levels. Addison's disease involves adrenal insufficiency with low cortisol. Congestive heart failure does not directly affect cortisol production. And renal failure may trigger stress responses, but is not a primary cause of high cortisol. The key point is that nurses should monitor for signs of cortisol excess, such as hyperglycemia, hypertension, and increased infection risk in clients with Cushing's disease. Question 24. Lastly, in this group, let us consider a respiratory emergency scenario. The nurse is caring for a client with carbon monoxide poisoning and must select the appropriate oxygen delivery device to provide the highest concentration of oxygen. The options are Option A, nasal cannula. Option B, Venturi mask. Option C, simple face mask. Option D, non-rebreather mask. The correct answer is Option D, non-rebreather mask. Here is the explanation. A non-rebreather mask delivers close to 100% oxygen, which is crucial for displacing carbon monoxide from hemoglobin and restoring oxygenation. Nasal cannulas and Venturi masks provide much lower oxygen concentrations and are not suitable for treating carbon monoxide poisoning. A simple face mask can deliver moderate oxygen levels, but is still insufficient in this emergency. The key point is that in carbon monoxide poisoning, rapid administration of high-concentration oxygen is essential to outcompete carbon monoxide and support the client's recovery. Question 25. Let us now look at a question involving fluid resuscitation in sepsis. A client weighing 107.27 kilograms presents with suspected sepsis, and the primary healthcare provider orders a fluid bolus of 30 milliliters per kilogram of 0.9% saline. The nurse must calculate how many milliliters to administer. The correct answer is 3,218 milliliters. Here is how we arrive at that figure. We multiply 30 milliliters by 107.27 kilograms, which equals 3,218.1 milliliters. When rounded to the nearest whole number, this gives 3,218 milliliters. The key point here is that in sepsis management, early fluid resuscitation with 30 milliliters per kilogram of isotonic crystalloid solution is essential to restore perfusion and prevent organ failure. Question 26. Moving on, let us consider a scenario involving pregnancy-related musculoskeletal changes. A pregnant client reports difficulty moving around, and the nurse must identify which spinal change commonly seen in pregnancy is most likely contributing to this concern. The options are Option A, ankylosing spondylosis. Option B, lordosis. Option C, scoliosis. Option D, kyphosis. The correct answer is Option B, lordosis. Here is why. As pregnancy progresses, the growing uterus shifts the woman's center of gravity forward, leading to an exaggerated lumbar curve called lordosis. This postural adaptation helps balance the increased weight, but often results in back discomfort and reduced mobility. The other options describe conditions unrelated to normal pregnancy changes. Ankylosing spondylosis is an inflammatory arthritis, scoliosis is a lateral spinal curvature, and kyphosis is excessive thoracic spine curvature. The key point is that lordosis is a normal spinal adaptation in pregnancy, though it may contribute to mobility challenges. Question 27. Let us now focus on newborn care. The nurse is caring for a newborn diagnosed with erythroblastosis fetalis and must understand the pathophysiology of this condition. The options are: Option A, the newborn produces an excessive number of red blood cells, requiring blood removal. Option B, the newborn's red blood cells are destroyed due to maternal fetal blood type incompatibility. Option C, the newborn cannot break down phenylalanine, leading to elevated levels. Option D, the newborn's red blood cells have a sickle shape, making them prone to damage during low oxygen states. The correct answer is Option B, the newborn's red blood cells are destroyed due to maternal fetal blood type incompatibility. This condition typically arises from an Rh incompatibility, where maternal antibodies attack fetal red blood cells, leading to hemolysis and fetal anemia. The other options describe unrelated conditions, such as polycythemia vera, phenylketonuria, and sickle cell anemia. The key point is that erythroblastosis fetalis is a preventable condition through appropriate administration of Rho-D immune globulin during and after pregnancy. Question 28. Next, let us look at a psychiatric assessment scenario. The nurse is assessing a client who exhibits avolition and must identify what characteristic to expect. The options are: Option A, difficulty maintaining balance. Option B, a wide and varied display of emotions. Option C, lack of motivation for goal-directed activities. Option D, noticeably diminished facial expression. The correct answer is Option C, lack of motivation for goal-directed activities. Avolition is a negative symptom seen in conditions such as schizophrenia, where clients struggle to initiate or sustain purposeful tasks. It significantly impacts daily functioning and independence. Difficulty with balance is unrelated, and while diminished emotional expression may occur alongside avolition, the defining feature is lack of initiative, not reduced facial expression or varied emotions. The key point is that avolition undermines a client's ability to engage meaningfully in self-care and social interactions. Question 29. Now let us focus on a scenario involving shock. The nurse is assessing a client for possible neurogenic shock. Which clinical finding would most strongly support this diagnosis? The options are: Option A, distended neck veins. Option B, slow heart rate. Option C, elevated body temperature. Option D, abnormally slow breathing. The correct answer is Option B, slow heart rate. Neurogenic shock results from the loss of sympathetic tone, typically after spinal cord injury, leading to unopposed parasympathetic activity. This produces hypotension, bradycardia, and hypothermia due to peripheral vasodilation. Distended neck veins, fever, and bradypnea are not characteristic findings. The key point is that bradycardia helps differentiate neurogenic shock from other types of shock, where tachycardia is more common. Question 30. Finally, for this group, let us look at a critical burn care scenario. A client has sustained full-thickness burns covering the entire torso and back. The nurse must determine which action should take priority. The options are: Option A, evaluate the client's respiratory function. Option B, prepare lactated Ringer's solution for fluid resuscitation. Option C, insert a urinary catheter for accurate output measurement. Option D, obtain the client's current weight. The correct answer is Option A, evaluate the client's respiratory function. In cases of extensive burns, particularly involving the torso, airway and breathing must be assessed first because of the risk of inhalation injury or airway edema. While fluid resuscitation, urine output monitoring, and weight measurement are critical, they follow the immediate priority of securing the airway. The key point is that airway management is always the first step in burn emergencies due to the rapid potential for respiratory compromise. Wait, before we go to the next question, are you serious about passing the NCLEX? Then you need to check out our complete NCLEX review course right now. You will get live classes, 100 hours of crash course animations, 500 hours of recorded lectures, thousands of NCLEX questions including 500 next-gen case studies, 15 mock CAT exams, and so much more. Oh, and let us not forget, an exclusive ebook and a study plan customized for you. Do not miss out. Click the link below and join our community of future nurses crushing the NCLEX. Question 31. Let us move on to newborn care and the prevention of heat loss immediately after birth. The nurse is implementing measures to protect the newborn from losing body heat and must identify which action best helps reduce radiant heat loss. The options are: Option A, thoroughly drying the newborn's skin with a towel. Option B, placing the newborn on a padded, covered mattress. Option C, using warm, humidified oxygen during care. Option D, positioning the bassinet away from exterior windows. The correct answer is option D, positioning the bassinet away from exterior windows. Here is the rationale. Radiant heat loss happens when the newborn's body heat transfers to nearby cooler surfaces, such as window glass, without direct contact. By placing the bassinet away from windows or cold exterior walls, the nurse reduces this risk. Drying the newborn's skin, as in option A, prevents evaporative heat loss. A padded mattress, as noted in option B, protects against conductive heat loss, while warm, humidified oxygen helps prevent convective heat loss, as seen in option C. The key point is that radiant heat loss is minimized by keeping the newborn away from cold objects that draw heat away from the body. Question 32. Now let us shift to a diagnostic scenario involving diabetes. The nurse is reviewing laboratory results for a client undergoing evaluation for type 2 diabetes mellitus and must identify which finding supports the diagnosis. The options are option A, fasting blood glucose of 110 milligrams per deciliter. Option B, hemoglobin, A1C of 7.5%. Option C, elevated serum insulin concentration. Option D, positive urine ketones. The correct answer is option B, hemoglobin, A1C of 7.5%. The explanation is that an A1C level of 6.5% or higher confirms diabetes mellitus type 2, reflecting elevated average blood glucose over the previous 2 to 3 months. A fasting glucose of 110 milligrams per deciliter, as in option A, points to prediabetes rather than diabetes. Elevated insulin levels, as in option C, indicate insulin resistance but are not diagnostic of diabetes. Positive urine ketones, as in option D, are more typical of diabetic ketoacidosis seen in type 1 diabetes. The key point is that an A1C level above 6.5% is a reliable marker for diagnosing type 2 diabetes mellitus. Question 33. Let us now look at a dosage calculation. A healthcare provider orders 3 liters of 0.9% saline to infuse evenly over 24 hours. The nurse must determine how many milliliters per hour to set on the infusion pump. The correct answer is 125 milliliters per hour. The calculation is straightforward. First, convert liters to milliliters by multiplying 3 liters by 1,000, which equals 3,000 milliliters. Then divide this total volume by 24 hours, resulting in 125 milliliters per hour. The key point is that accuracy in infusion rate calculations is essential to ensure safe and effective hydration therapy. Question 34. Now let us review a scenario involving ethical practice. The nurse is caring for a critically ill client who has an advance directive specifying do not resuscitate, or DNR, status. The client's adult children express disagreement with this decision. The question is, what is the most appropriate action for the nurse to take? The options are option A, ensure the advance directive is placed in the client's medical chart. Option B, record the family's concerns in the nursing documentation. Option C, ask the family what changes they would like to see in the directive. Option D, cancel the client's advance directive at the family's request. The correct answer is option A. Ensure the advance directive is placed in the client's medical chart. The reasoning is that the nurse must advocate for and respect the client's legally documented wishes, as autonomy is a core ethical principle in nursing. While noting family concerns is appropriate, it does not override the client's directive. Asking the family about changing the directive or canceling it is not within the nurse's authority. The key point is that the client's expressed wishes, as documented in a legal advance directive, guide the plan of care. Question 35. Finally, in this set, let us focus on pediatric assessment. The nurse is evaluating an infant with irritability and suspected acute otitis media. The nurse recalls that infants are at greater risk for this condition primarily because of which anatomical factor? The options are option A, immature cardiac sphincter. Option B, being fed in a semi-fowler position. Option C, introduction of solid foods. Option D, shorter, narrower, and more horizontal eustachian tubes. The correct answer is option D, shorter, narrower, and more horizontal eustachian tubes. Here is why. This anatomical structure makes it easier for pathogens from the nasopharynx to reach the middle ear, leading to infection. An immature cardiac sphincter is associated with reflux, not ear infections. Feeding position and the introduction of solids are unrelated to the risk for otitis media. The key point is that the unique anatomy of the infant's eustachian tubes predisposes them to middle ear infections. Question 36. Let us now focus on seizure recognition. The nurse is observing a client with epilepsy and notes a sudden loss of muscle tone lasting only a few seconds, causing the client to collapse. The nurse must identify the type of seizure involved. The options are Option A, atonic seizure. Option B, tonic-clonic seizure. Option C, absence seizure. Option D, complex partial seizure. The correct answer is Option A, atonic seizure. Here is why. Atonic seizures, sometimes called drop attacks, involve a sudden and brief loss of muscle tone that leads to the client falling and poses a high risk of injury. In contrast, tonic-clonic seizures, as seen in Option B, involve muscle stiffening followed by rhythmic jerking. Absence seizures, noted in Option C, are brief staring episodes, typically without loss of posture. Complex partial seizures, as in Option D, involve impaired awareness with automatisms like lip smacking. The key point is that atonic seizures can cause abrupt falls and require protective measures to reduce injury risk. Question 37. Next, let us consider the management of a sexually transmitted infection. A client is newly diagnosed with Trichomonas vaginalis, and the nurse must determine the most appropriate action. The options are Option A, initiate a 24-hour urine collection. Option B, implement contact isolation precautions. Option C, obtain an order for metronidazole. Option D, report the case to the local health department. The correct answer is Option C, obtain an order for metronidazole. The rationale is that metronidazole is the treatment of choice for Trichomonas vaginalis, as it effectively clears the protozoan infection and helps prevent transmission to partners. A urine collection, as in Option A, is not used for diagnosis, and contact isolation, as in Option B, is unnecessary since the infection is sexually transmitted. Reporting to the health department, as in Option D, is not required because trichomoniasis is not a reportable condition. The key point is that prompt treatment with metronidazole is standard care. Question 38. Let us now review proper restraint use. The nurse observes a newly hired nurse applying bilateral wrist restraints to a client. The supervising nurse must identify which action requires immediate follow-up. The options are Option A, securing the restraints to the bed frame. Option B, placing the client in a prone position. Option C, ensuring the quick-release buckle is easily accessible. Option D, checking the client's radial pulses every 2 hours. The correct answer is Option B, placing the client in a prone position. Here is the reasoning. Placing a restrained client prone greatly increases the risk of suffocation and is unsafe. Restraints should be applied in positions that protect the client's airway and dignity. Securing restraints to the bed frame, as in Option A, using quick-release buckles, as in Option C, and performing frequent neurovascular checks, as in Option D, are all appropriate practices. The key point is that safe positioning is essential in restraint use to prevent harm. Question 39. Moving on, let us consider sudden infant death syndrome, or SIDS, risk factors. The nurse is screening infants to identify who is at the highest risk for SIDS. The options are Option A, a preterm 4-month-old female who sleeps on her back and is formula-fed. Option B, a preterm 12-month-old male who sleeps prone and is formula-fed. Option C, a term 6-month-old male who sleeps on his back and is formula-fed. Option D, a preterm 3-month-old male who sleeps on his side and is breastfed. The correct answer is Option D, a preterm 3-month-old male who sleeps on his side and is breastfed. The rationale is that multiple risk factors are present here: preterm birth, male sex, young age at the peak risk period of 2 to 3 months, and side sleeping position. Although breastfeeding lowers SIDS risk, these other factors increase vulnerability. The other infants have protective factors or are beyond the age of highest risk. The key point is that preterm, male infants under 6 months who do not sleep supine have the highest risk for SIDS. Question 40. Let us now focus on complications of cold stress in newborns. The nurse is caring for a newborn experiencing cold stress and must identify which complication requires close monitoring. The options are Option A, elevated blood glucose levels. Option B, increased muscle tone. Option C, low blood glucose levels. Option D, metabolic alkalosis. The correct answer is option C, low blood glucose levels. Here is why. In cold stress, the newborn's body uses up glucose stores rapidly to produce heat, which can lead to hypoglycemia. Hyperglycemia, as in option A, is not typical in cold stress. Decreased muscle tone rather than increased tone, as noted in option B, is more common as energy reserves are depleted. Metabolic acidosis, not alkalosis, as in option D, is the usual acid-base disturbance due to anaerobic metabolism. The key point is that hypoglycemia is a major concern in cold stress, and prompt monitoring is critical. Just taking a quick moment to remind you, you do not have to prepare for the NCLEX alone. Our complete NCLEX review course is here to guide you every step of the way. Inside, you will find live classes, hundreds of hours of recorded content, detailed NGN question reviews, mock tests, study planners, and an NCLEX ebook, everything designed to make sure you feel confident on exam day. You have got this, and we can help. Look for the link in the description or pinned comment and join our supportive learning community today. Question 41. Finally, for this group, let us look at labor complications. The nurse in the labor and delivery unit must identify which maternal condition increases the risk for shoulder dystocia during birth. The options are option A, use of prenatal vitamins during pregnancy. Option B, gestational diabetes mellitus. Option C, preeclampsia. Option D, pre-pregnancy BMI within the normal range. The correct answer is option B, gestational diabetes mellitus. The explanation is that gestational diabetes increases the risk of fetal macrosomia, or large birth weight, which in turn raises the risk of shoulder dystocia during delivery. Prenatal vitamins, as in option A, do not contribute to this complication. Preeclampsia, as in option C, is associated with other maternal risks but not shoulder dystocia. A normal BMI, as in option D, is not a risk factor. The key point is that fetal macrosomia linked to gestational diabetes increases the likelihood of shoulder dystocia. Question 42. Let us now turn to a question about blood pressure measurements. The nurse is reviewing blood pressure readings obtained by unlicensed assistive personnel using the client's lower extremity. The nurse must understand how these readings typically compare to upper extremity measurements. The options are option A, systolic pressure in the leg is typically higher by 10 to 40 millimeters of mercury. Option B, systolic pressure in the leg is typically higher by 10 to 40 millimeters of mercury. The correct answer is option A, systolic pressure in the leg is typically higher by 10 to 40 millimeters of mercury. Here is why. Vascular differences between the arms and legs lead to higher systolic readings in the legs, while diastolic pressure remains similar at both sites. The other options are incorrect because diastolic pressure does not significantly differ between sites, and leg systolic pressure is expected to be higher rather than lower. The key point is that when using leg blood pressure measurements, it is important to establish a baseline and compare appropriately. Question 43. Moving on, let us consider dietary teaching for a client with hypothyroidism. The nurse is providing guidance and must determine which type of food should be encouraged. The options are option A, foods rich in fiber. Option B, foods high in saturated fat. Option C, foods high in calcium. Option D, foods high in potassium. The correct answer is option A, foods rich in fiber. The rationale is that clients with hypothyroidism often experience slowed gastrointestinal motility, leading to constipation, and a high-fiber diet helps promote regular bowel movements. Foods high in saturated fat, as in option B, should be limited to prevent weight gain and manage cholesterol levels. High calcium intake, as noted in option C, can interfere with thyroid hormone absorption. Potassium, as in option D, is not a specific focus in hypothyroidism management. The key point is that fiber supports digestive health in clients with hypothyroidism. Question 44. Let us now shift to interpreting cardiac rhythms. While reviewing a client's cardiac rhythm strip, the nurse observes an irregular rhythm with no visible P waves before the QRS complexes. The nurse must determine what this rhythm indicates. The options are option A, sinus tachycardia. Option B, sinus bradycardia. Option C, normal sinus rhythm with premature ventricular contractions. Option D, atrial fibrillation. The correct answer is option D, atrial fibrillation. The explanation is that atrial fibrillation is identified by an irregular rhythm and the absence of visible P waves due to disorganized atrial activity. Sinus tachycardia and bradycardia both display P waves before each QRS complex, and premature ventricular contractions occur as isolated early beats within an otherwise regular rhythm. The key point is that atrial fibrillation lacks P waves and presents with an irregular rhythm. Question 45. Next, let us look at perioperative medication outcomes. A client is scheduled for hip arthroplasty in 2 hours, and the nurse receives a prescription for tranexamic acid. The nurse must know what outcome would indicate that the medication achieved its intended effect. The options are: Option A, the client reports reduced post-operative pain. Option B, the client demonstrates improved lung function post-operatively. Option C, the client experiences reduced blood loss after surgery. Option D, the client has no signs of surgical site infection. The correct answer is Option C, the client experiences reduced blood loss after surgery. The reasoning is that tranexamic acid helps prevent excessive bleeding by inhibiting fibrinolysis, which is especially important during surgeries with high blood loss risk, like hip arthroplasty. It does not affect pain, pulmonary function, or infection risk. The key point is that tranexamic acid is used to minimize blood loss and reduce the need for transfusions. Question 46. Let us now review safe administration of anticoagulants at home. The nurse is teaching a caregiver how to administer a pre-filled syringe of enoxaparin. The nurse must identify which caregiver's statement indicates a need for further teaching. The options are: Option A, I will give the injection in the abdomen. Option B, I should push out the air bubble before giving the injection. Option C, it is okay to eat green leafy vegetables while using this medication. Option D, this medicine increases the chance of bleeding. The correct answer is Option B, I should push out the air bubble before giving the injection. The rationale is that the air bubble in the pre-filled syringe is intentionally included to ensure the full dose is delivered and to minimize bruising. The bubble should not be expelled. Giving the injection in the abdomen, as in Option A, is correct, and green leafy vegetables do not interfere with enoxaparin, unlike with warfarin. The key point is to leave the air bubble in place to aid proper dosing. Question 47. Finally, for this set, let us consider anxiety assessment. A client arrives in the emergency department with severe anxiety, and the nurse must identify the expected clinical findings. The options are: Option A, limited problem-solving ability and reduced attention span. Option B, heightened awareness of surroundings and awareness of anxiety. Option C, narrowed perceptual field but able to discuss prior coping strategies. Option D, inability to problem solve and feelings of impending doom. The correct answer is Option D, inability to problem solve and feelings of impending doom. The explanation is that severe anxiety results in a greatly narrowed perceptual field, disorganized thinking, and an overwhelming sense of fear. Limited problem solving with some attention is seen in moderate anxiety, as noted in Option A. Heightened awareness reflects mild anxiety, as in Option B. In severe anxiety, clients typically cannot reflect on or discuss coping strategies, making Option C incorrect. The key point is that severe anxiety severely impairs cognitive function and problem-solving abilities. Question 48. Let us now look at an emergency situation involving infection control. A client presents to the emergency department with fever, neck stiffness, and irritability, classic signs of bacterial meningitis. The nurse must decide on the priority action. The options are: Option A, administer prescribed ibuprofen to reduce fever. Option B, implement droplet precautions immediately. Option C, notify the public health department of a potential case. Option D, draw blood cultures as ordered. The correct answer is Option B, implement droplet precautions immediately. The rationale is that protecting others from exposure takes priority. While reducing fever, notifying authorities, and drawing cultures are all important, the immediate step is to prevent the spread of this highly contagious condition. The key point is that droplet precautions should be initiated as soon as bacterial meningitis is suspected to reduce transmission risk. Question 49. Now let us move to a safety scenario involving specialized equipment. The nurse is performing a safety check for a client with a Sengstaken-Blakemore tube placed to control esophageal variceal bleeding. The nurse must ensure that a specific item is readily available at the bedside. The options are Option A, emergency tracheostomy kit. Option B, sterile scissors. Option C, tracheostomy obturator. Option D, Youngkower oral suction catheter. The correct answer is Option B, sterile scissors. Here is why. If the tube migrates or balloons displace and threaten the airway, the nurse must act immediately to cut and deflate the balloons to prevent suffocation. While tracheostomy supplies and suction equipment are important for other scenarios, they do not address the airway risk associated with Sangstake-Blakemore tubes. The key point is that scissors at the bedside are critical for emergency management of this device. Question 50. Next, let us focus on procedural pain management. A client with 27% total body surface area, burns, including deep partial thickness and full thickness injuries, is scheduled for a dressing change. The nurse must decide which medication will provide rapid and effective pain relief. The options are Option A, intravenous hydromorphone 1 mg. Option B, oral oxycodone, extended release 10 mg. Option C, intravenous ketorolac 15 mg. Option D, fentanyl transdermal patch 12 micrograms per hour. The correct answer is Option A, intravenous hydromorphone 1 mg. The explanation is that IV opioids like hydromorphone act quickly and provide potent analgesia for severe procedural pain, which is essential during burn dressing changes. Extended release or transdermal medications are not suited for immediate pain control. The key point is that fourth opioids are preferred for rapid relief of acute procedural pain. Passing the NCLEX is not about luck. It is about preparation. And that is exactly why we created the complete NCLEX review course just for you. Inside, you will find live classes, over 500 hours of recorded lectures, 100 hours of animated crash course content, 500 detailed next-generation NCLEX-style questions, 5,000 previous exam questions, 15 full mock CAT tests, an exclusive NCLEX ebook, and personalized study planners for your unique timeline. Plus, you get 1 year of access so you can study at your own pace. Ready to take control of your success? Check out the link in the description and let us help you cross the finish line. Question 51. Let us now examine delegation and safety. The nurse is collaborating with unlicensed assistive personnel while caring for several clients and must choose an appropriate task to delegate. The options are Option A, provide oral hygiene to an unconscious client with a tracheostomy. Option B, assist a client with diabetes in interpreting their blood glucose result. Option C, help a client who has a fall history walk in the hallway. Option D, perform a sterile dressing change for a surgical wound. The correct answer is Option C, help a client who has a fall history walk in the hallway. The rationale is that ambulation support falls within the scope of UAP duties, as long as safety measures are in place. The other tasks require nursing judgment, aseptic technique, or airway management, which are beyond the scope of a UAP. The key point is that delegation should match the assistant's competencies and ensure client safety. Question 52. Moving on, let us consider the safe use of equipment during client transfers. When preparing to use a mechanical lift to transfer a client from a stretcher to a wheelchair, the nurse must follow proper technique. The options are Option A, keep the side rails of the stretcher raised during the transfer. Option B, instruct the client to cross their arms over their chest. Option C, wear gloves and a gown during the procedure as standard practice. Option D, leave the wheels of the stretcher and wheelchair unlocked for repositioning. The correct answer is Option B, instruct the client to cross their arms over their chest. The explanation is that this position helps protect the client's arms from injury during the lift. The side rails should be lowered, gloves and gowns are not routine unless exposure is anticipated, and the wheels must be locked to prevent movement. The key point is that client positioning and equipment stability are crucial during transfers. Question 53. Let us now review hematologic assessment. The nurse is assessing a client with multiple bruises on the torso and arms and must identify which lab finding most likely explains this. The options are Option A, white blood cell count 4,500 per cubic millimeter. Option B, platelet count 70,000 per cubic millimeter. Option C, activated partial thromboplastin time 38 seconds. Option D, hematocrit 40%. The correct answer is Option B, platelet count 70,000 per cubic millimeter. The rationale is that thrombocytopenia, reflected by a low platelet count, predisposes the client to bruising and bleeding. The other values are within or near normal limits and do not explain easy bruising. The key point is that low platelet levels impair clot formation and increase bleeding risk. Question 54. Finally, for this group, let us examine a chemotherapy safety scenario. The nurse is caring for several clients undergoing cancer treatment and must identify the situation requiring immediate attention. The options are: Option A, a client receiving chemotherapy via PICC who reports blistering at the insertion site. Option B, a client receiving chemotherapy who experiences nausea and vomiting during infusion. Option C, a client on oral chemotherapy who reports mouth burning when drinking orange juice. Option D, a client undergoing external beam radiation therapy who is sitting in the family waiting room. The correct answer is Option A, a client receiving chemotherapy via PICC who reports blistering at the insertion site. Here is why. Blistering may indicate extravasation of a vesicant chemotherapy drug, which can cause severe tissue damage. This is a medical emergency that requires the nurse to stop the infusion and follow extravasation protocols. While nausea, stomatitis, and sitting in the waiting room require intervention or education, they do not pose the immediate risk of tissue necrosis. The key point is that suspected extravasation must be addressed without delay to prevent permanent injury. Question 55. Let us now move on to a scenario involving pediatric respiratory care. The nurse is following up on an 8-year-old child with asthma who has recently been diagnosed with allergic rhinitis. The nurse practitioner has prescribed an intranasal corticosteroid and an intranasal antihistamine. The nurse must consider what is the most serious potential complication of allergic rhinitis in this case. The options are: Option A, disrupted sleep patterns. Option B, poor academic performance. Option C, an exacerbation of asthma. Option D, increased irritability. The correct answer is Option C, an exacerbation of asthma. Here is why. In children with asthma, allergic rhinitis can worsen airway inflammation and bronchial hyperresponsiveness, increasing the risk of an asthma attack, which could be life-threatening. Although poor sleep, academic difficulties, and irritability are possible consequences of allergic rhinitis, they are not as dangerous as the risk of an asthma exacerbation. The key point is that managing allergic rhinitis effectively is crucial for preventing asthma flare-ups and ensuring respiratory stability in children with asthma. Question 56. Let us now focus on transfusion safety. The nurse is preparing to administer a transfusion of packed red blood cells and must choose the correct intravenous fluid to safely accompany the transfusion. The options are: Option A, lactated Ringer's solution. Option B, 0.9% sodium chloride or normal saline. Option C, 0.45% sodium chloride or half normal saline. Option D, 3% sodium chloride. The correct answer is Option B, 0.9% sodium chloride. The rationale is that normal saline is isotonic and the only recommended fluid to use during transfusion because it preserves the integrity of the red blood cells without causing clumping or hemolysis. Lactated Ringer's contains calcium, which can promote clotting during transfusion. Half normal saline is hypotonic and could cause red blood cells to swell and rupture, while hypertonic saline could cause them to shrink or lyse. The key point is that normal saline is always the fluid of choice to accompany blood products. Question 57. Moving on, let us review the purpose of a health assessment. The nurse must understand why this fundamental step in the nursing process is performed. The options are: Option A, to collect both subjective and objective data about the client's health. Option B, to determine the effectiveness of interventions that have been implemented. Option C, to identify specific care interventions to be carried out. Option D, to take immediate corrective action for any problems found. The correct answer is Option A, to collect both subjective and objective data about the client's health. The explanation is that the health assessment provides a complete picture of the client's condition, gathering information the client reports, subjective data, as well as observations and measurements the nurse makes, objective data. Selecting interventions, evaluating effectiveness, and taking corrective action follow the assessment step. The key point is that a thorough assessment forms the foundation for accurate diagnosis and individualized care planning. Question 58. Finally, in this group, let us consider a teaching moment regarding lung sound assessment. The nurse is observing a student nurse auscultating lung sounds and must identify a statement that reflects the need for further teaching. The options are: Option A. Wheezes arise from narrowed small airways and usually do not clear with coughing. Option B. A pleural friction rub produces loud, rough, grating sounds, typically heard during inspiration. Option C. Thick secretions that clear with coughing cause crackles. Option D. Coarse crackles result from fluid or secretions in the large airways. The correct answer is option C. Thick secretions that clear with coughing cause crackles. The rationale is that thick secretions that clear with coughing actually cause raunchy, not crackles. Raunchy are low-pitched sounds that may clear after coughing. The other statements accurately describe wheezes, pleural friction rubs, and coarse crackles. The key point is that correctly identifying lung sounds helps guide diagnosis and management of respiratory conditions. Question 59. Let us now focus on evaluating treatment effectiveness in a sleep disorder. The nurse is caring for a client with narcolepsy and must determine which finding indicates that treatment goals are being met. The options are: Option A, improve focus and concentration. Option B, reduction in daytime episodes of unintended sleep. Option C, decreased occurrence of vivid dreams and night terrors. Option D, less avoidance of social situations. The correct answer is Option B, reduction in daytime episodes of unintended sleep. The rationale is that the hallmark of narcolepsy is excessive daytime sleepiness with sudden sleep attacks. A reduction in these episodes signals that treatment is effectively improving the client's wakefulness and daily functioning. Improved focus may result indirectly, but it is not the primary indicator of treatment success. Vivid dreams and night terrors are not typical of narcolepsy, and while social avoidance may improve, it is not the key outcome being targeted. The key point is that therapy for narcolepsy aims to reduce daytime sleep episodes and support safe functioning. Question 60. Let us now consider safe delegation in the context of restraint use. The nurse and an LPN or vocational nurse are managing care for a violent client who removed their IV and required wrist restraints. The nurse must determine which task is appropriate to delegate. The options are: Option A, collect data on the client's skin and neurovascular status. Option B, provide education to the client about why restraints were necessary. Option C, insert a new peripheral intravenous catheter. Option D, continuously assess whether restraints remain necessary. The correct answer is Option A, collect data on the client's skin and neurovascular status. Here is why. The RN may delegate data collection such as monitoring circulation, skin integrity, and pulses in restrained limbs to the LPN, VN. However, explaining the plan of care, starting IVs, and determining ongoing restraint necessity require RN-level critical thinking and decision-making. The key point is that LPN VNs can collect focused data, but the RN retains responsibility for evaluation and decision-making related to restraints. Question 61. Moving on, let us review central line care. The nurse is assessing a client's central venous catheter site and finds the dressing is loose and damp. The nurse must decide on the most appropriate action. The options are: Option A, reinforce the dressing by securing it with additional tape. Option B, remove both the dressing and the central line catheter. Option C, clean the site and apply a sterile new dressing using proper technique. Option D, apply a clean occlusive dressing directly over the old dressing. The correct answer is Option C, clean the site and apply a sterile new dressing using proper technique. The rationale is that a loose, damp dressing is contaminated and no longer protects the site. The nurse must remove it, clean the area with an antiseptic like chlorhexidine, and apply a new sterile dressing using a septic technique. Simply taping or layering another dressing does not address infection risk, and catheter removal is not warranted unless there is confirmed infection. The key point is that compromised central line dressings must be addressed immediately with strict sterile technique to prevent infection. Question 62. Finally, for this group, let us consider medication monitoring. The nurse is preparing to administer desmopressin to a client with central diabetes insipidus and must know which laboratory value requires the closest monitoring. The options are: Option A, serum sodium level. Option B, blood glucose level. Option C, serum magnesium level. Option D, serum calcium level. The correct answer is Option A, serum sodium level. Here is why. Desmopressin reduces urine output and promotes water retention, which can lead to dilutional hyponatremia if fluid balance is not carefully managed. Monitoring sodium levels helps prevent complications such as cerebral edema and seizures. Glucose, magnesium, and calcium levels are not significantly affected by desmopressin therapy. The key point is that nurses should be vigilant for signs of hyponatremia in clients receiving desmopressin and educate clients to report concerning symptoms promptly. Let us take a brief pause here, because I want to share something that could truly transform your NCLEX preparation. Imagine having everything you need in one place, from live interactive classes, 100 hours of animated crash course videos, and 500 hours of comprehensive recorded lectures, to 500 next-generation NCLEX-style questions explained in detail, 5,000 past NCLEX questions, 15 mock CAT exams, and an exclusive NCLEX ebook. Plus, you will receive personalized study plans to match your timeline, whether it is 1 week, 1 month, or 3 months. And you will have a full year of access. If you are ready to study smarter and feel confident walking into the exam room, click the link in the description and join our complete NCLEX review course today. Question 63. Let us now turn to newborn care during a home visit. The nurse observes parents giving their newborn a swaddled bath and must determine if additional teaching is needed. The options are: Option A, they unwrap the infant fully and wash the baby without the blanket. Option B, they use a mild soap for cleansing. Option C, they provide the bath in a warm, draft-free room. Option D, they wash and dry one body part at a time before moving to the next. The correct answer is Option A, they unwrap the infant fully and wash the baby without the blanket. The explanation is that swaddled bathing is designed to minimize heat loss by keeping most of the infant's body covered in the water while exposing and washing only one part at a time. Unwrapping the infant completely increases the risk of cold stress and hypothermia. Using mild soap, bathing in a warm room, and washing one body part at a time are all appropriate practices. The key point is that swaddled immersion bathing supports temperature stability and creates a calmer experience for newborns. Question 64. Let us now review percussion findings during physical assessment. The nurse is evaluating different body areas using percussion and must identify where a tympanic sound is expected in a healthy client. The options are: Option A, stomach; Option B, liver; Option C, normal lung tissue; Option D, tympany is always considered abnormal. The correct answer is Option A, stomach. The reasoning is that tympany is a high-pitched, drum-like sound typically heard over air-filled structures, such as the stomach or intestines. The liver produces a dull sound due to its solid nature, while healthy lungs produce a resonant tone. Tympany is normal in the right places, but would be concerning over solid organs or fluid-filled areas. The key point is that understanding percussion tones helps the nurse identify normal anatomy and detect abnormal air or fluid accumulation in conditions like pneumothorax or pleural effusion. Question 65. Finally, in this group, let us consider the evaluation of shock treatment. The nurse is monitoring a client with septic shock and must identify which finding indicates a positive response to therapy. The options are: Option A, mean arterial pressure, MAP, of 67 millimeters of mercury. Option B, urine output of 20 milliliters per hour. Option C, blood glucose level of 253 milligrams per deciliter. Option D, serum pH of 7.33. The correct answer is Option A, mean arterial pressure of 67 millimeters of mercury. The rationale is that a MAP of at least 65 millimeters of mercury is the target in septic shock because it reflects adequate organ perfusion. Although urine output is another important indicator, 20 milliliters per hour is insufficient. High blood glucose is common in septic shock but undesirable, and a pH of 7.33 indicates mild acidosis, suggesting ongoing perfusion issues. The key point is that maintaining an appropriate MAP is essential to ensure that vital organs receive sufficient blood flow during septic shock management. Question 66. Let us now move to a triage scenario involving medication side effects. The nurse is managing phone calls from clients at an outpatient clinic and must determine which client concern requires the most immediate follow-up. The options are: Option A, a client receiving prescribed dutasteride who reports decreased libido. Option B, a client receiving prescribed tamoxifen who reports swelling in the right leg. Option C, a client receiving prescribed letrozoles who reports hot flashes and night sweats. Option D, a client receiving prescribed filgrastim who reports bone pain. The correct answer is Option B, A client receiving prescribed tamoxifen who reports swelling in the right leg. The explanation is that tamoxifen increases the risk of thromboembolic events, such as deep vein thrombosis, and unilateral leg swelling is highly concerning for this life-threatening complication. In contrast, decreased libido with dutasteride, vasomotor symptoms with letrozole, and bone pain with filgrastim are common side effects that, while important to address, do not require immediate emergency evaluation. The key point is that any unilateral leg swelling in a client on a prothrombotic medication like tamoxifen should prompt urgent assessment to rule out deep vein thrombosis. Question 67. Let us now turn to peripheral neuropathy management. The nurse is caring for a client with lower extremity peripheral neuropathy and must choose the most appropriate intervention to prevent foot injury. The options are: Option A, perform the Semmes-Weinstein monofilament test during assessments. Option B, review the client's most recent capillary blood glucose result. Option C, obtain a prescription for gabapentin to address neuropathic pain. Option D, teach the client about selecting and wearing appropriate footwear. The correct answer is Option D, teach the client about selecting and wearing appropriate footwear. The reasoning is that protective, well-fitting shoes are the first line of defense against injuries that the client may not feel due to impaired sensation. While monofilament testing identifies neuropathy, and blood glucose management and pain relief are important, they do not directly prevent immediate trauma to the feet. The key point is that foot care education and appropriate footwear are essential for preventing injuries in clients with neuropathy. Question 68, finally. For this group, let us look at recognizing early pregnancy indicators. The nurse is interviewing a client who reports frequent urination and nausea and is concerned that she might be pregnant. The nurse must identify which category these symptoms fall into. The options are: Option A, confirmation of pregnancy. Option B, probable sign of pregnancy. Option C, positive sign of pregnancy. Option D, presumptive sign of pregnancy. The correct answer is Option D, presumptive sign of pregnancy. The rationale is that presumptive signs are subjective symptoms reported by the client that suggest but do not confirm pregnancy, as they can occur with other conditions. Positive confirmation requires objective evidence, such as hearing fetal heart tones or seeing the fetus on ultrasound. Probable signs are provider-observed findings that could still have other causes. The key point is that presumptive signs, like nausea and frequent urination, raise suspicion of pregnancy but require further evaluation for confirmation. Question 69. Let us now focus on a critical newborn assessment. The emergency department nurse is evaluating a 3-day-old infant whose mother reports that the baby appears excessively sweaty, feels hot, and refuses to feed. On examination, the nurse notes +3 brachial pulses, but absent femoral pulses. The nurse must determine which congenital heart defect is most likely. The options are: Option A, hypoplastic left heart syndrome. Option B, patent ductus arteriosus. Option C, transposition of the great arteries. Option D, coarctation of the aorta. The correct answer is Option D, coarctation of the aorta. The rationale is that coarctation of the aorta involves a narrowing of the aorta that typically results in bounding upper extremity pulses and diminished or absent lower extremity pulses. The baby's symptoms of sweating and poor feeding reflect increased cardiac workload and early heart failure. In contrast, hypoplastic left heart syndrome causes cyanosis and poor perfusion without pulse discrepancies. Patent ductus arteriosus produces a murmur and volume overload, but not this pulse pattern. Transposition of the great arteries causes profound cyanosis, not absent femoral pulses. The key point is that discrepancies between upper and lower extremity pulses in a newborn should raise immediate suspicion for coarctation of the aorta. Question 70. Let us now examine neurovascular assessment in a client with skeletal traction. The nurse notes that the client's foot is pale, cold to the touch, and has no palpable pulse. The nurse must decide on the priority action. The options are: Option A, reassess the foot in 20 minutes. Option B, readjust the traction. Option C, administer the prescribed PRN pain medication. Option D, notify the primary healthcare provider. The correct answer is Option D, notify the primary healthcare provider. The explanation is that these findings indicate compromised arterial circulation and suggest a possible medical emergency, such as compartment syndrome or arterial occlusion. Immediate provider notification is essential to prevent permanent damage or loss of the limb. Reassessment in 20 minutes would delay critical intervention. The nurse should not adjust skeletal traction without orders, and giving pain medication would mask symptoms without addressing the cause. The key point is that prompt recognition of the 6 Ps, pain, pallor, pulselessness, paresthesia, paralysis, and poikilothermia, demands immediate escalation. Question 71. Let's look at this scenario. During handoff to a critical care nurse, the reporting nurse suggests that the primary healthcare provider refer the client to a support group upon discharge. The nurse must identify which section of the ISBAR format this suggestion corresponds to. The options are Option A, situation. Option B, background. Option C, assessment. Option D, recommendation. The correct answer is Option D, recommendation. The rationale is that the recommendation section of ISBAR is where the nurse offers guidance on the next steps, including referrals or actions needed for ongoing care. The situation section focuses on the immediate concern prompting the communication. The background provides context and history, and the assessment conveys the nurse's clinical judgment regarding the client's status. The key point is that using the recommendation section of ISBAR ensures continuity of care by advocating for the client's future needs. Move to next scenario, 72. The nurse is performing an initial prenatal assessment on a client who reports no menstrual period for 2 months. During the pelvic examination, the nurse notes a softening of the cervix. The nurse recognizes this finding as which type of pregnancy sign? Here are the options. A. Presumptive sign of pregnancy. B. Probable sign of pregnancy. C. Positive sign of pregnancy. D. Physiologic adaptation unrelated to pregnancy. Correct answer is probable sign of pregnancy. B is correct because a softening of the cervix, known as Goodell's sign, is a probable sign of pregnancy. Probable signs are objective findings that are observed by the examiner and strongly suggest pregnancy. But they are not definitive because they could also occur in conditions unrelated to pregnancy, such as hormonal changes or pelvic tumors. Finally, let us close with a question on communication and care transitions. Question 73. The nurse is reviewing the laboratory results of a client newly diagnosed with multiple myeloma. Which finding should the nurse expect based on the pathophysiology of this disease? Options are A. Elevated calcium levels. B. Decreased serum protein levels. C. Increased red blood cell count. D. Elevated platelet count. Correct answer is A. Elevated calcium level. Let's see the explanation. Multiple myeloma is a malignant proliferation of plasma cells in the bone marrow that leads to increased bone breakdown, osteolysis. As bone is destroyed, calcium is released into the bloodstream, leading to hypercalcemia. Elevated calcium levels can cause weakness, confusion, constipation, and risk of kidney stones. Thanks for watching. We will see you in next video.